All right, so I now would like to introduce Andrew Bledsoe. Andrew is the Deputy Director of the Kentucky Health Information Exchange. We're happy to have KHIE here to present on all this great information. So,
Okay, thank you, Brent. Okay, well, hello, everyone. Thank you for having me back this year. I can't help but feel, I don't know, there's just something about this room setup and the microphone that I feel like I'm on one of those daytime talk shows. And like I need to kind of come out to the audience and we're going to start asking for perspective. And how did that make you feel? No, I don't know. So we'll get to that in a minute. We'll get to that. But anyway, so as Brent said, I'm Andrew Bledsoe. I run the Kentucky Health Information Exchange. We're now housed in state government within the Office of the Inspector General. So you better come work with us or we will come for you is kind of the way but no, that's not really it. That's not really it. Okay. I have to stand close to the screen, but not in front of the screen is what they've instructed me to do. So anyways, many of you, we're just a show of hands. How many of you you've heard about KHIE? No, there's okay. That's most everybody. Yeah, Amy, you've heard of it? Okay. You know me. Well, I'm not going to go too deep into who we are and what we do, but what I do want to take a few seconds to do is talk a little bit about the growth that we've experienced recently. I know I'm really bad to do this, to kind of brag about ourselves and the work that we've been doing. But over the last year, I've done a lot of work with other states, and it's really, truly given me a perspective of what we have here with Kentucky Health Information Exchange is unparalleled against the other HIEs and the other states across the nation. And so I do this because I want to point it out to everyone and hopefully help to foster not only some interest in using KHIE and working with us, but also a sense of pride because the Kentucky Health Information Exchange is funded largely by taxpayer dollars. So this is not my HIE, this is all of yours HIE. And so we just want to make sure that we are building a tool and we have a resource that is helpful to everyone. That is my goal at the end of the day is I recognize all of you and the work that you're doing is truly tremendous out there in the healthcare community. And I just want to be in some way a resource and a tool and provide you the information that can help you all do your job. And so, but to talk a little bit about us, since being founded in 2010, well, being founded is a loose term because we have long roots back into the early 2000s and 90s. And, but we had our first connections in 2010. We do work with 100% hospitals, but 98% of the hospitals are live sending us data. I don't know if Mount Sterling is here, but I'm going to call them out because they are the holdout. We're waiting on them, but they're implementing in the EHR. And so we will be able to say 100% soon. But that is, again, unparalleled to the other states and the other HIEs. I have yet to come across HIE that can say they work with 100% of the hospitals in their geographic area, especially over the full state. And so that is really tremendous and remarkable that we've been able to achieve that over the years and has given us the amount of data and the amount of information that we have. I don't know, tell me if I feel like the microphone's cutting in and out. It's good, okay. A few other things. We continue to grow with the number of organizations that we're working with. We have our ePartner Viewer is our web-based portal that we will give out to anyone authority to view clinical information. And we're logging now 6,000 registered users within that system. That is continuing to grow. One thing to make note of here is 12,000 live data feeds sending us data into the Health Information Exchange. I hear people saying that, well, there's not much data in the Health Information Exchange. Well, that may have been true in years past, but with 12,000 data feeds sending us around just under 30 million messages a month, nobody can really make that claim anymore because we have a tremendous amount of information and our goal is to provide that back to you. And so what we've done, we recognize with a large amount of data that you have to make sure that it's quality data and you have to present it in a meaningful way. So we've done a lot of work around making sure that how we're presenting information to you is in an as easy to understand and use format as possible. We're continuing to grow and evolve and listen to the requests and the issues and continuing to grow this into a tool that's helpful to you all. And then lastly, just a couple of comparisons here. We are the first HIE in number of overall connections. Again, I mean, that's a pretty big deal to think of all the other HIEs and all the other states across the country. We have one of the largest in number of connections. We're first in the unique patient searchable in the master patient index. We have just over 10 million unique lives represented within the HIE now. Again, that's a lot of individuals. That's a lot of data that you can have access to, a lot of patients. We are the first HIE to receive CMS outcomes-based certification. Now, that might not seem like a big deal. It might not be a big deal for you all. It's a big deal for me because we spent several years working on that. And to be able to brag that we were the first is a nice accomplishment. But really what it means for you is that we can continue to receive federal funding to offset the expense of running the HIE so that we can continue to provide you this tool and resource without having to charge for those services. And lastly, we're second in the number of participating organizations connected to KHIE. So we have a large number of participation agreements, large number of organizations contributing data across all spectrum of healthcare specialties, subspecialties. We have a pretty wide margin in the data that we're exchanging. So just wanted to take a few minutes to kind of talk through and really help to cultivate that sense of pride, because this is something that everyone in this room is helping to contribute to, whether you're contributing data, whether you're using the data or just talking about it. It's remarkable what we have all grown together. I want to talk more specifically about this past year and what we've done. So one of the things is we've really started to be very intentional in the work that we're doing and how we're communicating the services that we have to offer. So we have launched a provider ambassador program, and this is a cohort model and attempt at communicating the services that we offer. We launched our first provider ambassador program back in September, and it was a small group. It was 3 hospitals. I think there was 12 members of that. And what we did is we met every 2 weeks and we did a deep dive into our ePartner viewer. So one service, and we were intensely training representatives from that organization on that one service. So then the hope is that they become the ambassadors within their organization and can go back to others within their organization and help to communicate the services that we offer. Because those individuals are going to know better who within their organization can leverage and use KHIE than we would. And so we train them on the ePartner viewer, and then they have to go out and communicate with other employees in the organization and help to roll that out more effectively. We are continuing to grow that. It was very successful. We've seen a huge uptick in the utilization, patient searches, number of individuals using the ePartner viewer. And so we are going to roll the ambassador program out to other services. So around our event notification system, Platinum integration, and some of our public health direct data entry 2023. Again, the goal there is to, rather than broadly trying to communicate what we have to offer, this is an opportunity where we can really train you on the services and how it can meet your specific workflows. So more information to come there. If you're interested, please find one of us at the KHIE booth and we can talk about it. We've really worked a lot on our reporting capabilities. So public health reporting has continued to grow. The pandemic certainly pushed us to be to really facilitate a lot of that public health reporting in a real-time electronic format. So our goal and kind of how we've been positioned is to electronically capture data as much as possible. And anytime that we can capture it electronically and it can be transferred from one system to the other, then we can replace manual processes and manually having to fill out and fax in forms. That's manual work on your side, then that's manual work for the local health departments, and we can more automate that. So we've expanded those capabilities so that we can take multiple file types, multiple connection types, and receive that in different ways. We've also opened up direct data entry opportunities for lab reports and for case reports, and expanded that well beyond COVID to all communicable diseases now. So we're doing some tremendous work there. We're even now moving over HIV data, STDs, lead, and sending them to the appropriate registries within public health. So we've greatly increased that. So if you're resulting any communicable diseases in your office, we can help you automate those processes. We launched our image exchange last year, and we've been really working on growing that network. And so what that means is, well, for you to be able to access the images within our system, we have to have a network of images that are available within our system. And so we've been working with hospitals and imaging centers across the state to gain access to their PACS systems. And then we represent and reflect those images in our ePartner viewer, and we can also transmit them back into PACS systems and EHR systems. And so we're growing that network. We have, I think, currently just under roughly 20 hospitals that are live on that. We do have about 65% of the hospitals across the state committed to this project. And so we're just working on getting them onboarded. There's a lot of opportunities, a lot of use cases there, but at the end of the day, it's making those images available to you again in our web-based portal, but also back into your native systems in a query-based approach. What we'll talk about in a minute is full integration with kynect resources. So social determinants of health has been a huge topic for several years. People have been coming at social determinants of health from a few different angles. And within the cabinet, we're working collaboratively to try to create and build resources to help your organizations with that. And that's what we'll spend a majority of the time talking about. And we really talked about this last one with the public health reporting capabilities. So that's where we've been this past year, a little bit about where we're going for 2023. One area of focus always at the forefront is data quality. So we do have a lot of information. We have access to a lot of information, but we have to make sure that that is quality information so that it's usable for you within your organizations. We have a team that's dedicated to data quality. We have a project manager and full team that is actively and continually monitoring the historical quality, but also building processes for increase in quality as we move forward with new onboarding. So that is, again, something we're always working on. We're growing our ambassador networks. Again, we're really honing in and being intentional with who we're talking to and how we're communicating to them. Historically, we have always worked with a lot of the administration level and then with the technology individuals, but we really don't get to those who would actually be using and benefiting from the system. So that's the goal of the ambassador network, and we're going to continue to roll that out through some of our other services. We're also working ongoing on strategic partnerships. So more than just a healthcare provider, we do work with a lot of other healthcare organizations, accountable care organizations, different associations to try to just continue to grow the network and the amount of data that we also exchange with. We were just having a conversation in the back of the room with the eHealth Exchange Network. That's another one. So we're doing this both at a state level and also at a national level. Data analytics. This is one of those places where you've told us and we've listened. So for years, we've heard that reporting is something that is greatly needed. You know, we're setting on all of this information and all of this data, 30 million messages a month, and we can provide it to you on an individual basis. But to date, we've not been able to build and provide reports on an aggregate basis. And so we are working to procure and bring in technology that will allow us to provide analytics both from a population perspective, and then we can hone in and be a little more specific and intentional. So that is something that we will be working on in 2023. User engagement, this is coming from the work that we're doing with our ambassador network and trying to really bolster those who would be using our system and communicating with them the benefits that they can receive. And then finally, our event notifications. We have tremendous opportunities with our event notifications. We know where patients are seeking care and when they're doing so. And so we want to be able to tell that to you as proactively as possible. So we're really going to be pushing the needle on those event notifications, both in the types of notifications we're providing and also in how we're providing them to you. We've added in over the last couple of years multiple mechanisms that you can receive event notifications from. And so our goal is to increase awareness and user adoption of those systems as well. So that's a little bit about the state of KHIE, where we've been the past year, where we're going this year. This ultimately impacts all of you because that's how you can engage with us. Those are the services and ways that you can receive data back to you. I like to focus on that because we've really worked on the opportunities that we can provide data back to you meaningfully. But please don't anyone forget that we also need access to your data in order to provide that back out to others. So please just make sure that you're continually working with us and being good stewards of your patient information and making that available to the HIE. I want to talk now, I'm going to switch gears and go a little bit more into social determinants of health and talk about some of the collaborative efforts that we at the cabinet are making to help your organizations. I think many of you know about KHIE, you know what we do, but in case you're not familiar or aware, at the core of our services, we are seeking to move electronic protected health information from one healthcare facility to another. I mean, that could be doctor's office to doctor's office, doctor's office to hospital, hospital to public health, to the CDC, to an ACO, anywhere in between. We are moving electronic protected health information. Well, I like to show this graph, and I think this is old. This is very old, but it's a really good depiction about the data that we are receiving. The green bars across the top reflect the claims information and how much information and data we're able to glean from claims. I mean, I don't want to diminish claims at all because we still receive a lot of valuable information from them. We receive medication information, procedures. There's still a lot of valuable information there. We've built a lot of processes around it, payment processes, value-based programs. We do analytics on claims. So not to invalidate claims in any way, shape, or form, but within the health information exchange, we connect to EHR systems and we collect and grab the information that's stored within your EHR system. So you're storing vital signs. You've taken a blood pressure, you know this individual's blood pressure, you've done a hemoglobin A1C. When you enter that information into the EHR, that's then when it's made available to us through a connection with KHIE. And so I like to show this to delineate there the difference, because what we're receiving is real-time information when you enter it in your EHR, and that's what we're mostly exchanging within our system. Now, we took a step back and we were evaluating as social determinants of health was kind of an emerging trend. And we started to try to identify and look at the opportunities that we have to be a resource here. First, what we knew is we actually had a lot of social determinants of health information. Many organizations are already coding this information in an ICD-10 format or a LOINC code on a results message. And so we actually already had a lot of information available on individuals and their specific social determinants of health. So that's one thing we knew. Another thing was the cabinet has a system called Kynect Resources. That is a quote resource engine where individuals and organizations can log the resources that they have to make them available broadly to Kentuckians. And so if you have a financial program that you want to promote, if you have a transportation that you want to be able to provide, a transportation service, you can log those resources inside of Kynect Resources. And then also you can complete assessments on patients. All of the connectors are working with individuals across the state to complete assessments. Individuals can log in and can complete their own assessments that identify their social determinants of health, and then they are matched to resources within their area. So that's the Kynect Resources platform, also housed, managed, and facilitated within the Cabinet for Health and Family Services. So we both have information. Both of our systems have data. Actually, I think this kind of shows that delineation a little bit better. Kynect Resources here, that system assesses the patients through those assessments. They're searching and connecting to the available resources and then referring them back out. On the KHIE side, what we're doing is we are evaluating, or we're capturing, or rather, healthcare organizations, you all are capturing social determinants of health information, sending that into us, And then we are at that point standardizing and displaying that back to other healthcare entities. So if you tell us that a patient has a financial insecurity, or let's say transportation issue, when that patient goes on to maybe another provider or a specialist, they can easily see, hey, this patient has financial instability. Maybe we need to be conscious of that when we're prescribing medications, or this patient has transportation insecurity. Can we reasonably refer them to a specialist 2 hours away in Lexington or Louisville? And so that's kind of our role in this, is we can collect and present this information back out to the healthcare community so that it's meaningful to you all. So we receive that data from LOINC codes, ICD-10 codes. We also receive that data from Kynect resources. So when individuals log in and complete an assessment, that data is actually being populated back into the health information exchange. So we can be as broadly communicating and as comprehensive as possible. Now, these SDOH domains or indicators are very important, because what we've done at the cabinet level is we've all collectively said, we've looked at our services across the cabinet, we've looked at social determinants of health that are in the kind of the industry, and we've said these 18 are our priority focuses. So this is what we're working on. So everything that Kynect Resources is focused on centers around these 18 identifiers, and everything that we capture and present are also focused on here. So we have mapped all of the social determinants of health into one of these 18 fields. And the way that we've done that, so we know those LOINC codes coming in, those ICD-10 codes coming in, we standardize, we map those into one of those 18 areas, and then we give it a status indicator. Excuse me. That would be red, yellow, or green, so critical, important, or stable, or no data available. Both Kynect Resources and KHIE standardized to those 18 identifiers and to that categorization there. So what we did is, when we were looking at this, we had experts coming in from Kynect Resources, from the community organizations, from provider organizations, from the government, to help us to map to that. Because what we have to do is, if you send us in an ICD-10 code on transportation insecurity, well, we have to try to determine, is that going to be red, yellow, or green? Excuse me. And so we mapped every possible code, ICD-10 and LOINC, into one of those 18 indicators, and then to one of these areas as well, so that both of our systems are talking the same language, and we can communicate this information at a common level in all of our systems. And so the way that that looks, actually, I don't think I have I don't have a slide here, but the way that that looks, and the way that we present that in our ePartner viewer, and we can show you that back at the KHIE table, is we present to you, if you were to go in and query a patient, you say Andrew Bledsoe, and so you go to our Social Determinants of Health tab, we present all of our 18 indicators, and you get a quick review of where that patient is. So you can see red at transportation, you can see green at housing, and you can really quickly see where that patient may be and how that may impact the care that you're providing that patient, or maybe and then we also present each individual social determinant of health that is contributed to us. And so on the other side of the screen, you're going to see that UK Healthcare sent in that they have transportation insecurity. Kynect Resources sent to us that they have financial instability. And so you can look at both the micro level and the macro level, however you prefer, for the work that you're doing with the patients. So just to kind of round us out here, I think we are, again, very uniquely positioned because of how the HIE is owned and operated from within state government, within the cabinet. It gives us a really unique collaborative opportunity. Also, similarly, Kynect Resources, owned and operated from within the cabinet, it gave us that opportunity to be able to leverage the data that we have in both systems to send back and forth, and then also to be able to more effectively provide access to important information that you need within the healthcare community. And so we're utilizing that actionable social determinants of health data. We're making it back available to you. We're making it available to Connect resources. We're helping to make sure that those community resources that are logged are utilized and effectively communicated across the state. We're working on increasing patient engagement. We're helping to bring them in within Connect resources and help them by showing them the opportunities they have and matching them to those resources. And then also, if we have any hospitals in the room, through this effort, through these systems, they will help you meet those HRIP quality measures for 2022, 2023, and beyond. And we are working closely with Medicaid and the Hospital Association to build out an effective social determinants of health program, and making it electronic and as easy and as intuitive as possible as we move forward. And ultimately, kind of what we're always striving for is the triple aim: better individual patient health outcomes, better population health, and healthcare cost efficiency. So with that, we have 4 outreach coordinators who would love to talk to you about this. They can show you how our ePartner viewer presents the social determinant of health information. They can talk to you broadly about our services. They're really good therapy, listening ears. So if you just need someone to talk to, you can go back and talk to them as well. But please reach out to them, become familiar with them, because they're the ones that will help you through the process, identifying what you need, getting access to information as well. Also, we do a lot of work on our website to make sure that it is current, and we provide as much resources and information on there as possible. So please check out our website for our up-to-date information as well. Great. Are there any questions? Okay.
We have, can you hear me?
Mhm.
Yes, we have a couple online. First, are the slides available? And I will answer that. We do have the slides available, and this session is being recorded, so you can always go back on the Hoover app and watch this session. The second question is, are there plans to increase the number of organisms on the DDE? Currently, the only organism that we can currently submit through DDE is MRSA.
Yep. So we are growing that out so that it's going to cover full reportables. And that's going to be both on the lab direct data entry and the case reporting direct data entry. And so we are actually wrapping up that work, and it should be being rolled out within the next month or 2.
Great, thank you. Do we have any other questions?
Yeah.
So in the social determinants of health module, if you see like UK healthcare updated financial strain, and then they go to another provider and the provider updates that information, are you able to see archives from like past? You are.
Yep.
Okay.
So both of those are considered in the overall patient indicators.
Okay.
So we consider the fact that there are multiple accounts of financial insecurity. And then as they continue to come in, one may come in originally that they're in the red,
Sure.
and then, that color is going to change because
Sure.
it evaluates it. But then it also will display all of those, any of them that have been sent
Okay.
as well. So you
you'll
can
be able
sift
to
through
see
them
change
yourself.
over time.
Yep.
Great.
So
Thank you.
you can look back and see, 2 years ago they had financial instability. Yep.
Thank you.
Yep. Good question
Okay.
here.
Hold on one second. I'll bring you the mic. It's all yours.
Can you clarify the reportable diseases? So you say you have a electronic connection. We don't have to fill out the form manually anymore, that you can do a connection with KHIE for STDs and HIV.
Yep. So we have several different ways to do that. We can connect your EHR HL7 connection. So when you enter it in your EHR, it's going to come across automatically. We do flat files for SFTP uploads as well. And then a lot of that just kind of depends upon the capabilities of your system. And then if there's 3 or 4 different connection mechanisms within that. And then if those don't work, we have the direct data entry option where you can log into the portal and enter the information. It stores some preset data. So like information about your organization is automatically stored in there so that you can just jump straight to that patient's information that you're contributing. And then that will actually flow into a case report so that you can, say some STD. You started out as a lab, you send the lab in, then you have to follow up with that EPED 250. you can just continue on and fill out the information for the case report. And then it's automatically sent to NEDS so that your local health department and DPH has access to that. So they're not waiting on a fax. They don't have to manually enter it. It automates the whole process.
Any other questions? All right, I have one comment, and it was, there's great value in the ambulance run sheets to gather patient information available through the ePartner viewer. And so,
Yeah, we have, so we have a connect, so in the state of Kentucky, all EMS runs are required to file those run sheets with the Kentucky Board of EMS. So as soon as those are made available within the Kentucky Board of EMS system, those are made available to KHIE. So we have access to all of those run sheets as well. And so we see it, it's not, it is growing in some of them being real time. So if the ambulances are using a technology system, some of them can be real time. But they also have 30 days to file that with the Kentucky Board of EMS. So some of them may not be in real time, but there's a lot of valuable information in there.
great, thank you. Any other questions? All right, well, Andrew, we appreciate your time today.
Thank
Thank you
you.
for presenting. Always
Absolutely.
great information.